Today, let us discuss about an important case presentation regarding severe acute malnutrition. So, this is a case presentation. So, most common severe acute malnutrition in infancy is marasmus. In childhood is Kawashiorkor. So, let us get into the case presentation. Muthupadi, a 15-month-old child coming from Palayambatti with an informant as mother with good reliability, came with the chief complaints of having failure to thrive for 2 months and cough for 6 days. So, whenever you present a case of pediatric case, you need to mention the patient name, patient age, and patient address with the informant mother, and with the reliability score and their mother's name. And talking about the clinico-social presentation, you need to mention the mother's occupation or father's occupation. You need to mention with the history. What is that? You need to mention in this case sheet. You can see here. In this case sheet, you can see where they have referred and what type of the family, that is whether it belongs to middle class or lower middle class, like that. You have to classify your scale. In this case sheet it is not mentioned, but you need to remember few things. In pediatric case sheet, in a pediatric case sheet, you need to mention name, age, sex of the baby, and who is the informant reliability, what is the informant name, and his father and the baby's father name, and what is his occupation, what is their family's economic scale, socio-economic scale, and where they have came for, like that. You have to write that, and you have to write the chief complaints. Now, talking about the chief complaints, they are saying failure to thrive for 2 months and cough for 6 days. In the same way, you need to mention your chief complaint, and after that you need to mention a history of presenting illness. In the history of presenting illness, you need to mention that whatever the child is saying, whatever the mother is saying, you need to mention it. For example, here the case sheet, it is mentioned like the child was apparently normal before 4 months, and after which there is inability to gain weight and loss of weight for 2 months. So whether it is inability to gain weight or loss of weight, you need to mention both. Okay, if inability to weight is there, then that is also malnutrition. If loss of weight is there, then that is also malnutrition. So you need to ask whether he is not gaining weight or whether he is losing his weight. So you have to ask that cases with respect to the informant who is present near the baby, and you should ask clear history over chief complaints. In this case here, the patient was admitted first in the private hospital, and he has been referred to the government hospital for the treatment. Okay, so that is the case, and after that they have mentioned some more cases regarding severe acute malnutrition. What are the causes for severe acute malnutrition? Which includes marasmus, Kawashiorkor, all those things, and you can superimpose. It can be due to persistent diarrhea. So you can rule out diarrhea. So GI symptoms like any diarrhea present, so dysentery is present, or any waterborne infections are present, or any respiratory pathology like pneumonia or present, like that you can ask. Okay. Some more histories have been asked, but those are not needed for now. You can ask jaundice here, and you can also ask about the feeding pattern of the baby, since it is basically depending on the feeding pattern, right? So you need to ask. And regarding the clinical features of Kawashiorkor and marasmus, you need to ask about edema, you need to ask about muscle wasting, you need to ask about irritability, alertness, lethargy, and you need to ask about the hair which is present in the all over the body, and you need to ask about burning maturation, hematuria, you need to ask about altered sensorium, you need to ask about puffiness of face. All those things you need to ask. And there is bleeding tendency, history of any bleeding tendency is associated, myopathy is associated, any body deformity is associated, like that you need to ask. So also you need to ask about measles. Since measles features are very common over severe acute malnutrition, you need to ask about measles features too. So don't forget to ask about exanthemus fever, any rash is present, like that you need to ask. Okay. So regarding past history, your past history also should include exanthemus fever, TB, jaundice, diarrhea, undiagnosed, any diagnosed congenital anomalies present, like that you need to ask in the past history. You need to add congenital anomalies in the case sheet. That is very important. Talking about your treatment history, there is no previous surgery and hospitalization is not there, like that you need to ask. Talking about the antenatal history, you need to add first trimester, second trimester, third trimester. In the first trimester you will add first UPT, how you have consumed and how you are diagnosing it by UPT or what, like that you have to say, and it is booked and immunized or not, like that you have to add. And after that, first trimester, second trimester, third trimester, first mention the scan. First trimester your scan is dating scan and NT scan. Second trimester your scan is anomaly scan. Third scan is growth scan. So this is your scan. Next you will mention is drug. What you will take in the first trimester, you will take iron. You will take only folic acid supplement. You will take only folic acid supplement in the first trimester, and you will take iron and folic acid supplement in the second and third trimester. Also in the there is no drug history over first, second, and third trimester. You will mention about drug intake history. After that, you will ask about specific features of the first, second, and third trimester. First trimester, you will have nausea, vomiting, fever with rash, and you will ask about any burning, any radiation exposure, any burning maturation, like that you will ask. And in the second trimester, you will ask about blurring of vision, nausea, vomiting, and you will ask about swelling of legs, puffiness of face. All those things you will ask. Headache, like that you will ask, and polyuria, polypsia, polyphagia, you will ask, and weakness, generalized fatigue, like that you will ask. And in third trimester, and second trimester, you will ask about quickening, and in the third trimester, you will add up the ability to perceive the fetal movements. You will ask about general features of BP, and also you will ask about giddiness, fatigability, dyspnea, palpitations you will add up, and in all trimester you can add up bleeding PV, leaking PV, and lower abdominal pain is present or not, like that you will ask. In the natal history, you will first say in the order, first how the delivery, what is the date of delivery, what is the time of delivery, what is the birth order, and what is the date of delivery, time of delivery, place of delivery, what is the birth order, what is the mode of delivery, and what is the birth weight of delivery. Order, keep it in the order. First, date of delivery, place of delivery, mode of delivery. Then, what is the birth order, birth weight. Next, you will ask about whether the baby cried or not, whether the baby is kept in NICU or not, and whether the breast milk is given or not. Like that, you will ask in the natal history. So, this is very, very important. You keep it in order such that you won't forget it. First, date of delivery, time of delivery, mode of delivery, and birth order, birth weight, once again I will say date of delivery, place of delivery, mode of delivery, type of delivery, birth order, birth weight, whether the baby cried or not, whether the baby placed in NEC or not, whether the baby is given with feeded with breast milk or not. Like that you will say. In the postnatal history, you will add up any delayed meconium passage, yellowish discoloration of skin sclera present or not, phototherapy kept or not. You will ask about complementary feeding, whether given or not, the breastfeeding is given for 6 months or not, and all those things, demand feeding is practiced or not. Because in this case, postnatal history is very important. So you need to ask about jaundice, you need to ask about any intestinal pathology, you need to ask about urine stool passage, you need to ask about complementary feeding, sleep pattern, all those things plays an important role here. Past obstetric history, you need to add about you need to ask about marital history. In marital history, you need to add infertility treatment, you need to add about consanguineous marriage, you need to add about degree of consanguinity, RH incompatibility present or not, you need to ask about any abortion history, you need to ask about marriage, how long they have married, and menstrual history of the mother you can ask or ask. That is about your wish. It is better to add in the pediatric case and OG case, but in this case they have not included. If they have not included, you just leave it. Nobody will ask you why you have left that. Developmental history is very important. You need to write the developmental history with respect to all 4 domains. The developmental history is discussed in a separate video which is tagged over this video, so you can watch it and come back so that you can easily remember the developmental history very clearly. So in this case they have discussed about the developmental milestones the baby has achieved. So if you have any confusion over the developmental history, just see that video and come back. Next, immunization history. You need to ask about the till date immunization history of the baby since the baby is 8 months old, and the last vaccine dose here is 6, 10, 14, and 16th month is there, 9th month is there. So the last vaccine would be in the 14th week. The 14th week vaccines would be you have to ask those vaccines, right? Last immunization since the baby is 9th month here, MR vaccine, vitamin A vaccine is used, and in endemic places Japanese encephalitis is used. Environmental history is same over every cases. The environmental history is discussed separately in a separate video. You can watch it over it so that you can get an idea over that. And talking about your general examination, you need to ask about pickle, you need to ask about anthropometry, and you need to importantly add about mid upper arm circumference, and you need to add about BMI. BMI is very important here, and you need to add about you need to add here basically your head circumference or chest circumference. All these things you need to add up, and you need to say head to foot examination, in which you have to discuss anything it is abnormal or not, head, hair, face, eyes, mouth, all those things you need to add up. If anything is present, you need to give an idea. Next about is your diagnosis and your programs that can be included in this. The program included can be mentioned separately. You can add up here. You need to calculate, very important is diet history. For calculating diet history, I have mentioned a separate video. You just watch back and come in order to have a clear idea over that. So this is about your SAM. Viva part, the next part. So regarding what is the problem identified, you have to speak and you have to talk about investigations. In this, CBC, RFT and USG can be taken. Why CBC? Because any infectious pathology can be ruled out. RFT and USG abdomen will also be checked. Treatment, whether any infectious cause is there, you can give ceftriaxone, amikacin, and you can add ORS for rehydration. You can give tablet zinc, whether diarrhea is present or not. You have to check and you have to give a dietary management. It is based upon the nutritional rehabilitation center where F75, F100 diet is followed. No, that you can mention here. The Viva part is very important, which will be discussed in this video itself in a later part. So advice to you have to give it as a 3. Advice to the patient, advice to the family, advice to the community. Advice to the patient, since it is a pediatric age group, you will avoid it. Advice to the family, that is your mother, you will advise her to give breastfeeding with weaning food supplements, and you need to give clean water supply. You need to have clean water. You need to purify by boiling it. You need to give nutritious weaning food that you will add here. And prevention is primary prevention, secondary prevention. You need to give complete immunization in the primary prevention. In secondary prevention, early diagnosis, and all those things you will be adding. Programs includes SAM includes ICDS, Nutritional Rehabilitation Center, Baby Friendly Hospital Initiative, Balwadi Nutrition Program, and Poshan Abhiyan School Lunch Program. All those things will be coming under this. Organizations will include UNICEF, WHO, WHO. So this is about your overall SAM. So then in this video itself, I will be going to discuss you the Viva part of the malnutrition.